The topic for today is building a healthy nation, youth and public health. In this topic, I have divided this entire session into two main aspects. What is the role of youth? What are the main challenges that the youth are facing in terms of their health, mental health and physical health? Along with that, we will also be dealing with how to build a robust public health system for the country. So without much further ado, I want many people here, whoever is seated, many of you are on the phone even now. Raise your hand if you have checked your phone in the last 30 minutes. Come on. That's every one of you. That is almost everyone out there has been on the phone in the last 30 minutes. Yeah, this includes even me. I was also checking for messages and other WhatsApp conversation. Now, all those people who raised their hands, how many of you were physically active by doing some sort of exercise in the last one day? Come on, raise your hand now. That's what I want you to say what you did. Yeah, climbing the stairs. And what about you? Okay. So, climbing the stairs, going around the campus, these are some of the basic tasks that we can do. But what constitutes a public health system? In India, we have the sub-health centers in all the villages. We have the primary health centers in all the taluks. We have the secondary health centers and we have the tertiary health centers. In every district, there is a hospital. So this constitutes a public health system, but that's just one aspect of it. Because public health is not just about doctors, it's not just about hospitals. It's about creating an environment where people can live with a healthy lifestyle, they can join different communities, and together it's all about happy living in the community. Think about it like this. If you get clean water in your tap, that is a sign of good public health system. In India, unfortunately, we haven't reached that level yet. But one day, when we get clean water in our own taps, that is the sign of a real good public health system. Similarly, if you can think about it, if we get good nutritious meals during our midday meal packages in schools and colleges, that is another sign of the state promoting good public health. So, public health is now divided into 5 core areas. That is creating a good environment, disease prevention and control, health education, which is about, educating the next set of doctors, nurses, and other paramedical staff, early detection of diseases and control. So this is all about vaccination and prevention of other diseases. And finally, a social system for public where people can join together, live in harmony, they can go for walks, they can go for cycle rides, they can go for treks and hikes. This is what we dream of as a good public health system. Let's compare that to other countries. This was what was the headline that was running just about 4 or 5 years ago in India. When the COVID-19 pandemic hit us, there was all this talk about mass cremations in New Delhi. India is suffering from a huge COVID crisis. There is medical oxygen shortage in the hospital, and every day we were setting new infection records. But there is one other headline that the media doesn't highlight, that we don't generally talk about, and that is this. There was a cost that we paid. We went into a lockdown in 2020 and 2021. Many of you might remember that we couldn't step out of our homes for 2-3 months together, and all our classes shifted online, through which we could even submit our assignments and do other things. Because we shifted to a full-fledged lockdown, this is the headline that nobody talks about. There were 1 lakh lives saved, and this is documented in the Economic Survey of India, which talks about how India prevented the spread of 37 lakh cases of COVID by imposing a lockdown. How did this happen? When when we were all spending time at homes and being safe and trying to avoid the infection of COVID, the health infrastructure of our country was being continuously ramped up. All that medical shortage, medical oxygen shortage, the shortage of remdesivir, and everything was being fixed when we were in lockdown. Of course, this is a story that we, as the MP office, did in Bangalore South. We came up with unique models to combat the COVID-19 infection. When people were in the lockdown and senior citizens especially were unable to step out of their house, step out of their apartments to buy medicines or to get groceries, we had a delivery model which we combined with Swiggy, Zomato, Dunzo, Rapido, and with a flat delivery fee of just 10 rupees, we ensured that anybody who wanted to get medicines, who wanted to get groceries during COVID-19, in the middle of lockdown, they were able to easily access it. And this is some sort of leadership that was implemented across the country and during the COVID-19 model especially. Next, while we were in lockdown, we also ensured that Bangalore South's residents, people of Bangalore South, received vaccination to prevent further onset of COVID-19 infection. And we are proud to say that we conducted the largest vaccination drive in the shortest period of time. We as a country in India were giving vaccination up to 1 crore per day. 1 crore people per day were getting their COVID-19 vaccine in the middle of the pandemic. This is unheard of. This hasn't happened anywhere else in the world, and we as Indians must be proud of this achievement that we together have done with the COVID-19 pandemic. Next, during the COVID-19 infection, many of us were scrambling for beds, hospital beds, ICU, medical oxygen beds. But what we were instead given is this scam, where a lot of people, in exchange for money, were booking beds in hospitals and denying treatment to all those who urgently needed. Thanks to our efforts, we were able to unearth this scam and ensure that within 100 hours, 4,000 beds, that is in Bangalore South alone, were free for the use of public, and many lives were saved because of this. Now, that is the story of Bangalore South, which I briefly got into. Here is the story of India. Before 2014, the story is right there. In the year 2005, the number of government hospitals in the country, India is a huge country, the 7th largest in the world. We have tough terrain, different geography, hilly areas, deserts, coastal areas, and Malnad region. 7,000 were the number of hospitals that India had in the entire country. That is the number of hospitals we built from 1947 to 2005. Then the story plummets. The growth, you can see there. There is 11% growth annually, and now from 2015 to 2021 alone, there is 3 times the number of government hospitals that are there in the country. Today, from 5,000 in 2005, we have 60,000 government hospitals in the entire country, and this is the speed at which India is rapidly expanding its hospitals. Along with hospitals, you also need beds. It speaks for itself that the number of beds, along with the hospitals, also saw a good increment from 2015 to 2021 especially, and now we have over 9 lakh. That data is from 2021. Today, when we think about 2025, we have 9 lakh beds, more than 60,000 hospitals, and this is leading to India becoming the pharmacy of the world. Along with that, India is also a global medical tourism hub. This means that we invite a lot of people who wouldn't get their care in their part of the country. Even within India, if you think about West Bengal, if you think about Jharkhand, if you think about Odisha, many of the facilities that are not available in that part of the country is available in the southern part of India, especially in Bangalore, in Mangalore, in Manipal, in Vellore, and in Cochin. As a result, we see that we also get a lot of domestic medical tourists as well as international medical tourists, with Bangladesh, Maldives, Afghanistan leading the chart. This is just from the year 2021, and we have seen a constant increase in the number of medical tourists that India has supported. India can aspire to have a system like that. But we must also understand, we must also acknowledge the kind of achievements we have made already. In this particular slide, we have all seen the news articles about the UK's health system, National Health Services. In that, if you want to get admitted into a hospital, there is a 1 year waiting period for you. 1 year waiting period just to get a checkup done, just to get an appointment in a hospital. In India, we don't have that kind of a horrible scenario at the moment. And that is all thanks to the kind of health infrastructure that we have built over the last 10 years especially. The number of medical colleges have been doubled. The number of AIIMS, which used to be only centered around Delhi, has now been expanded to across the country. And even in Karnataka, Dharwad and Raichur are about to get AIIMS. Number of medical seats, the number of doctors that are passing out every year are now more than 1 lakh. So we have a robust health system which can cater to 1.4 billion people, but we are only halfway there. What is working for India is this Ayushman Bharat health scheme. Ayushman Bharat Tale, we are covering all the BPL card holders below poverty line, the most vulnerable section of the population, gets a health cover of rupees 5 lakh per year per family. Through this, we have ensured that we have covered almost 50% of the population, and in the vibrant list of medical facilities that are available, whether it's in government hospitals or in private hospitals, Ayushman Bharat has got you covered. Along with coverage, we also need to set up this digital health record of every patient that we have. We need to know what are the comorbidities, what has this patient been diagnosed with earlier, and the system for that we came up with is the ABHA card, Ayushman Bharat Health Account, ABA card anta kariತೀವಿ. Through that, we have already set up 64 crore ABA cards. So that is again, more than 50% of the country now possess ABA card, and we have a track of their medical records, the largest medical depository ever. Finally, teleconsultation is some other topic that we need to really think about. When it comes to Russia, they have set up hospitals in almost every center. Russia is larger than India. It's the largest country in the world. India faces its own challenges with respect to terrain, with respect to getting doctors to operate from every center. Many of our doctors here will shy away from community service. But there is another way to fix this problem, and that is through telemedicine and teleconsultation. India has also started a robust teleconsultation project through which we have ensured that 26 crore people have already been diagnosed for something or the other. That is about the public health system. Now, here, all of us youngsters who comprise 65% of the population are somehow caught in this health crisis. We may not realize it. You would have seen in the news that people who are even working out in the gym are suffering from cardiac arrest and getting strokes. Nobody has an answer as to why this is happening. Unless it happens to your family, to someone close to you, to someone around you, you wouldn't even realize the severity of this problem. The major problem that we face is that in our colleges, in our campuses, there is this constant pressure on us to perform, to be liked. There is this peer pressure that we have to be part of any friends group. We have to show. Even one photo that we upload, it should be something that will go viral. And the pressure that is stemming from this is leading to this 1 in 5 people suffering from anxiety or depression. This is the mental health aspect of the problem that we are dealing with. Plus, of course, you know, a lot of academic pressure is leading to a lot of suicides among the student population, among youngsters. People preparing for exams like IIT, NEET, even college entrance exam, or even one of your final semester exams. The pressure of not being able to perform well, the pressure of failing one exam is leading to a 90% academic stress, which contributes to the rising suicide rates that we are seeing in the country. Plus, this is once again what I got into the talk earlier. Most of you are on your phone all the time, whether it is in the classroom, whether it is in the conference, or even when you are in the toilet. Perhaps if we made waterproof phones, which might soon be a reality, maybe we would carry the phone to the washroom while taking the shower as well. We spend almost 7 hours per day on our phone. That is the average screen time among teens. This is a dangerous precedent. Whether we are on Instagram, whether we are on Twitter, on X, whether we are on WhatsApp, this is a dangerous trend that we don't have an answer for. We instead call it doom scrolling. This is leading to the young population being in high risk of chronic conditions before you turn 40. People generally suffer from all these diabetes, hypertension, sugar when they reach a certain age due to work stress above the age of 55. You know, our fathers are maybe now suffering from sugar and diabetes, but this is now affecting even our children, even the young population of the country. And soon enough, it might be affecting you, or you might already be suffering from type 2 diabetes and not realizing it. Obesity, type 2 diabetes is a real threat to this country. India is already the diabetes capital of the world. And the day may not be far when youngsters, a large population of youngsters will also turn diabetic. Here, in this picture, this is where I have to keep the talk interactive to ensure that you are following me, to ensure that you are with me in this conversation. Guess the amount of sugar. How many teaspoons of sugar is there in this glass of Coke, Coca-Cola, or any other? Yeah, the one in the second row wearing the blazer, please go ahead. Yeah, 5 teaspoons of sugar. Okay, any other guesses? 0, 10, okay, 5 and 10. The answer is 8 teaspoons, maybe 500 ml as 10 teaspoons of sugar, but we all know that drinking huge amount of Coca-Cola is bad for our health. So instead, what did we do? We started consuming fruit juice. Fruit juice, we don't realize, also has sugar. Maybe it has slightly less amount of sugar, but even this packaged mango drink, not the freshly squeezed juice, but the packaged juice. Not to defame any brands, but these are the major brands that we consume in our country. Guess how much sugar, how many teaspoons of sugar this has? The same people, if you can guess again, 5 and 8. So it is 5 teaspoons of sugar may not seem so bad, but you do realize that because you know that Coca-Cola has a large amount of sugar in it, you stop consuming Coca-Cola that much. And instead you shifted to consuming this 3 to 4 times a week. Now what is the aggregate of this? 1 Coca-Cola per week was 8 teaspoons, but 4 mango juice per week is now 20 teaspoons of sugar, which is higher than what you used to consume. If you think about it, generally when we brush our teeth, we use the entire bristle of the toothbrush, and then we brush our teeth. Do we need that much? What we must realize, and it is actually written in the back of your pack, if you have noticed it, we only need a pea-sized amount of toothpaste to be on the toothbrush. But instead, we consume, without knowing, a large amount of sugar early in the morning when we wake up and before we go to sleep. So we all know of this, we are aware of this, and it is up to us to be aware and make healthy choices. Because of a lot of viral videos from a blogger called Food Pharma, his name is Revant Himmat Sinka, he exposed how Bonvita is promoting itself as a health drink, and a large number of children are consuming it. Because he exposed how bad Bonvita is for your body, they cut down sugar by 14%, and the similar story goes to the Maggi ketchup that we consume. They also started to cut down their sugar content by 22%. What I'm trying to tell you from this is that when you, as a consumer, raise your voice, you as aware citizens make the world get to know that your labeling in products is all about misrepresentation of branding. The brands, as the person who's producing your product, will be forced to comply with law, will be forced to rebrand themselves, and will be forced to give you a healthier product. Think about it like this. All the good ingredients in the world go to all these products, FMCG products made in European countries and United States. But India, the same brand, the same Himalaya, the same Nestle, the same Cadbury, our ingredients are of substandard quality, and we as aware consumers of all of this must raise our voice and ensure that we get better products. The other thing, now that we realized as youth that we are facing this bigger problem, we came up with the Fit India movement in 2019. And a lot of people, stars like Neeraj Chopra, people like Vinesh Phogat, and other people have been our Fit India ambassadors. What they are trying to tell you is, as youngsters, pick up a good habit, follow a good diet, make sure that you are disciplined with this and maintain consistency, and you will see a lot of change in your own health. I'm sure you have seen this person's photos before in this presentation also. He is the only member of parliament in the entire world to complete the Ironman challenge. How many of you here are aware what the Ironman challenge is? The person at the back, the person in the front row, and the third row. Yeah, any of you, if you can raise, the third row person, if you can raise and tell me, do you know about the Ironman challenge? Can you come a bit to the front, please? I cannot hear you. So, 1.9 kilometer of swimming, 90 kilometer of cycling, and 21.1 kilometer of running. All of this, it's a triathlon. You have to complete all of this in 8.5 hours. And this is not even called the full Ironman, it is called the half Ironman. The full Ironman is obviously double of this. He is the first and only public representative to have completed this Ironman challenge. And that, you know, is an inspiration for all of us as youngsters. So make these alternate choices. Walk during your phone calls. Don't sit and talk for long hours. That is a simple thing that we can take away from this. Take the stairs, like our gentleman in the front suggested earlier, that this is the only physical activity that he did in the last one day. And finally, replace 10 minutes of your doom scrolling to 10 minutes of squatting, and these small impacts would have made a big change in your own life. Yoga is another soft power that India holds. You might not realize the number of yoga centers, the number of people who practice yoga. There is all this yoga spa, yoga, doing yoga with puppies, doing yoga with dogs. It's all become a trend. It all started in India. Yoga not just combines physical exercise, but it also contains the importance of meditation and pranayama, which, is a wholesome, healthy lifestyle that is suitable for people of our age. The gentleman here, everyone knows about his achievement. Virat Kohli he waited 18 years for an IPL trophy, but he finally got it for us. Thank you for those loud chants for RCB. We are all proud Bangaloreans. We are all proud of what Virat Kohli has done. So here in this section, I'm taking you on a personal journey. I used to be a sports journalist for the last 6.5 years. And I got to cover the biggest of football matches, the biggest of IPL matches, and I got to interact with a lot of athletes. However, I realized that I am constantly talking about their underperformance, that they are not disciplined enough. We used to always see Virat Kohli get really angry in the cricket match, really in the test matches when he plays against Australia and other countries. We have seen that aggression, and we know that this is what he represents. Whenever I used to get the chance to meet him or interact with any of these athletes, I would feel inferior about my own fitness level. I wouldn't say that I was very fat back then or very overweight, but unless I follow their path, unless I follow that regime, unless I am as disciplined as them, I only then will be able to be qualified enough to write about their performance. So I used to play football. Then I enrolled myself in mixed martial arts, and just for the sake of fitness, I've gotten hit on my eye, I've gotten hit on my face so many times. And now, even if you throw so many punches at me, the discipline, the consistency, and the experience of what I have gone through during training has prepared me for all those punches that you can ever deliver to me. So youngsters, you being in the colleges, you would have pulled off so many all-nighters, studying before the exam, completing your projects, doing those assignments which would be due the next day. But when athletes need recovery, we are no different. 8 hours of sleep is a minimum that recovery time will take you a long way. That is what is going to fuel your energy for the next day. So even if you study the whole night and you miss your sleep, it may give you some short-term gains, it may give you some extended period of time to prepare for the exam. But in the long term, you are paying a huge cost with your health. The other thing, I am giving you this lecture about making healthy food choices, getting the right amount of sleep. But I know you're all in college, you're all getting only that small amount of pocket money from your homes, from your parents, once a week. I used to get 20 rupees per week. 20 rupees per week I used to save up for 1 month and then have one bel puri. That is the way that I went and approached my college life, and I know the story is the same for you also, just the amount may differ. What I'm trying to tell you is, you may think that eating healthy is also eating more expensive food. I know organic food costs a lot. I know shifting to millets instead of rice takes off a huge amount of money from your wallet. But there are still simple substitutes such as fruits, such as homemade snacks, and so many other options that are available. Make sure that you can also have nutritious meal, can also have affordable meals even when you're in college. Youngsters, I only have this request. Take up some sort of physical activity. It can help you beat loneliness. It can help you get that dopamine level that you need to get through the day. It can help you beat stress. And most importantly, it builds this sort of community that we together can go for a trek. We together can go cycling. Even our cities, European cities are known for their walking pathways, their jogging tracks. In India, we have a lot of potential, a lot of places which can be developed into centers of sporting excellence. It's all, that is the kind of public health system that we must visualize when India becomes 100 years in 2047. By 2047, along with all the things that I described with respect to being fit, being healthy, consuming a lot of nutritious food, let's also ensure that one side we are ramping up the system, and on the other side, we ensure that health coverage reaches to even the most vulnerable population, even the most isolated village of our Malnad or of our Northeast or even in Uttarakhand or somewhere else in the country. We also have this vision of setting up one medical college in every district which can support the load of this huge amount of population that is residing in our rural settings. Finally, we need to also ramp up our medical staff. 50 lakh is what India requires by 2047. We are producing 1 lakh doctors per year. To have 50 lakh doctors, we don't have 50 years, we just have 25 years more. We need to ramp up that system, and finally, as youngsters, as the community that is going to lead this, prioritize health over convenience. That is all I would like to say. I leave you all with this wonderful quote which we must remember, because the world is changing. During the poster competition earlier, I saw how brilliant students of the NSS from different colleges from Belgaum and Coorg and other places, they came up with smart prosthetics. And one more group came up with beyond the drill in dentistry. So proud of your innovation and so proud of your efforts. This is the talent that we must nurture, but let's also ensure that there is a lot of change that is going to happen in the next 10 years. Let us not underestimate the change that is going to happen in that 10 years, because a lot of AI, a lot of medical technology is continuously under development, continuously under innovation in India and in other countries. So keeping that in mind, I maybe have time for a couple of questions. So thank you all for being a wonderful audience. Let's build that robust public health system as youngsters. And Jai Hind, Jai Karnataka.